Aniya Walker. I'm currently a junior at Corinth High School, and today I'm here to present to you the global issue that my group and I thought needed to be addressed and a potential solution for that issue. First off, did you know that on average, drug prisoners spend more time in federal prisons than rapists do, who often get out on early release because of the overcrowding in prisons? The problem I'll be examining today is overcrowded prisons, and my research is based off of the question of how can we reduce the amount of drug offenders in overcrowded prisons? So, what is overcrowded? Let's start with the definition. Overcrowding, according to dictionary.com, is defined as filling an accommodation or space beyond the maximum capacity or what is usual or comfortable. Every gym facility, elevator, and office has a maximum capacity, for safety precautions, that is. If this auditorium was jam-packed with everyone, it would be hard to get out if a fire or other emergencies arose. So how is America handling the situation in their prisons? When prisons have reached maximum capacity, they pack even more prisoners into the same prisons, and most are nonviolent drug offenders or first-timers. In order to get to the present day of our jail systems, we have to know how overcrowding became. Richard Nixon's war on drug policy of 1969 was aimed to make Americans believe that drug users were dangerous and a threat to America, so he wanted to imprison them all. Nixon failed to realize that the ones using the drugs were addicted. So instead of treating the problem, Nixon tied addiction to crime. He also failed to realize that drug users and drug traffickers are not the same. Many drug traffickers sell their merchandise, while drug users just use the drugs for a high. Instead of targeting the traffickers, Nixon targeted the users, which only packed the prison system even more. Yet the drugs were still on the streets because the traffickers weren't being captured. According to the U.S. Bureau of Statistics, between 1977 and 1985, the total growth in state and federal prison systems had increased by 68%. During the same period of time, the population of local jails had more than doubled. The American criminal justice system holds 2.3 million people in their prison facilities. America houses 25% of the world's prison population, but is only home to 5% of the world's population in all. In 2015, 18 of America's states have packed their prisons to maximum capacity. Drug arrests give residents of over-policed, predominantly Black, Latino, and poor communities criminal records, which then reduces employment prospects and increases the likelihood of longer sentences for any future offenses. If you weren't sent to jail and rather to a rehab place, then you wouldn't lose your rights to live and adapt back to society, which leads me to my solution. The way things should have been done was by shifting the use of drugs to a public health issue and sending drug addicts to rehabs, not prison. This is a potential solution to decrease overcrowded prisons. We need to start looking at drug users as addicts, and the use of drugs should be a public health problem, not a crime. We are taking drug users from prisoners to patients. Nonviolent drug convictions are defining characteristics of America's federal prison systems, but they only play a supporting role in the local and state levels. While most people in state and local facilities are not locked up for drug offenses, most states' continued practice of arresting people for drug possession destabilizes individuals' lives and communities. Here is a pie chart created by prisonpolicy.org showing the percentage of people locked up for a nonviolent drug offense. As you can see, more than half of nonviolent drug offenders are locked in state prisons. According to the Bureau of Justice Statistics, from 1982 to 2007, there has been a decrease in the arrest of drug trafficking and an increase in the arrest of being in possession of drugs. This is a potential lead to the result of first-time offenders being imprisoned. The people that do the trafficking are more than likely not caught. So what's the problem, you think? Well, prison overcrowding leads to poor prison conditions, resulting in increased mental health issues, self-harm and suicide, inmate violence, death in prisons, diseases such as AIDS and HIV, gang violence, which leads to police brutality and jail rioting. Data from the Bureau of Prisons shows that in 1988, the staff to inmate ratio was 1 staff member for every 3.68 inmate. That figure includes both prison guards as well as administrative personnel. By 2002, that ratio was 1 staff member for every 4.32 prisoners. The ratio today is slightly higher, 1 staffer per 4.9 inmates. On the state level, the guard to prisoner ratio is also somber. There's 1 guard for every 6.7 prisoners, according to American Correctional Association. Now let's look at overcrowded prisons from a global perspective. The problem with overcrowded prisons across the globe is not so different than it is here, but countries are either killing off their nonviolent drug offenders or just sending them and locking them in jails. So how are some countries addressing the issue? Cambodia, a poverty-stricken country, uses CTCs or compulsory treatment centers that are aimed at personal drug users. At these camps, drug users get exactly what they need, help, not incarceration. How would you expect someone to get rid of their drug addiction by packing them in a jail with thousands of other members for over 10 years? This program, like many others, get that the way of stopping drug uses is through rehabilitation. Portugal, which was the first country to decriminalize drugs in Europe, also started using the rehabilitation method. Instead of punishing people without really helping them reconsider their life decisions, Portugal offers drug addict counseling, needle exchange programs, and access to hospitals. Since starting this approach, Portugal has gone from arresting 14,000 people per year for drug offenses to just around 6,000. It went from having a high heroin epidemic to having the lowest drug usage rate in the European Union. Not only are the jails and prisons less full, but people are using less dangerous drugs. Switzerland, for example, has seen a number of drug injectors with HIV has reduced by over 50%. In conclusion, if the government were to see drug use as a public health problem, then prison centers would not be as packed and overcrowded, taking prisoners and making them patients.